we are not going to discuss any particular question, but definitely we'll discuss what do you mean by anxiety to excellence, how to score maximum marks in MD as well as DNB examination. So basically student, what you have to understand, first of all, that though the name is mentioned as it is a microbiology, it's not a microbiology, it is something called macro or mega. We have a vast syllabus. Students always feel they have read, they know the concept. Fundamentally still they feel always whenever there is an exam, you are always stressed and you feel that you are not able to answer and still you feel you are not prepared for the exam. So why this anxiety is there? Basically, you need to focus on your preparation style. You have to do slight variation in the preparation which leads you differentiate from you among the rest of the people and make you a topper. How? First of all, understand what happens in whenever you read, you keep on reading the thing but you never revise it within a span of 2 days. You collect so many notes now, like Preeti Sharma ma'am's notes are good, this person's notes are good, you start collecting it, but you don't understand the concept, you never master the concept. Mere collecting of the notes or just simply reading many topics without revising it will not help you. Ignoring practical examination until the end. See, majority of students, they feel first let me focus on the theory which will be asked in the theory. Later on, within the 10 days, I will prepare for the practicals and I will score the marks. But it's not like that. The approach of practical will help you to write your concept in the theory as well. So never ignore your practical until the end and leaving the theory question blank in your question paper. So the difference between an average performance and the topper is not the intelligence, it's the preparation strategy. So how you have to understand and change your preparation strategy, that we have to understand in today's topic. So first of all, whatever you read, you have to revise it within the 2 days span. So next day you prefer it to speak in front of your colleagues or your juniors, or just merely ask your senior resident or assistant professor in your college, madam please ask me something related to that, and by this you can revise it. Regarding the theory notes, whatever the notes you are collecting, like you have understand, you have collected note of pathogenicity island, quorum sensing, quality control in microbiology, etc. But what is its basically concept follows in that, you have to understand. Once you know the concept, even if you haven't revised it, you can able to write something, and whenever you will be asked in the Viva, if you know the concept, you can enumerate it and present it. So the two most important thing is that those things are revising the concept as well as improve your concept, understand the topic by concept, and revision of your whatever you have read in your theory as well as practical. Now, what is the difference between an average student as well as a distinction student? So basically what an average student generally we do, they focus, the moment they got the paper, he or she will start writing without thinking how to approach. They don't emphasize on the time durations. They write then short note in a big paragraph and even left some blank pages. What you have to understand is, first of all, you have to think from an examiner side. See, like me, I don't have a very good handwriting, but I know how to present. See, for handwriting, it is something you cannot change, but the presentation you definitely can work on. So what we focus, your presentation should be appropriate. You should focus on the flowcharts, definition, diagrams. Now majority of students will mention that, madam, we can't use any color pencils or any color pen or black pen in your exam. but definitely you are allowed to use pencils. Go and purchase 4B and 6B pencils. These are mainly used for sketchings. When you use this pencil, your images would be better. Whatever the image you want to draw, you draw it with these pencils. always always label your images. Use maximum flow charts. Whatever you write, it should have headings as well as subheadings with the bullet points and the time management. And what is 60% strategy? That we are going to discuss in a while, how you can do this. So first of all, understand the knowledge presentation. There is a different approach for theory and practical. For theory, it is knowledge plus presentation plus time management is equal to distinction. But in practical, knowledge into presentation into confidence is equal to success. Now you feel why these two methods are different? I'll tell you. In your theory paper, you are not facing your examiner, but your whatever you have mentioned, that itself speaks. So you are not speaking, but your content is speaking. So for that, whatever your knowledge is, that if you present it accordingly with the time management, you will get a proper marks. So the presentation, we have focus, heading, subheading, flow charts, diagrams and bullet points. Now the time management. How to focus the time management, that we are going to discuss. In practical, see, you know the answer, but your presentation, the way of speaking is like I have asked you, what is the various theories of the Gramstein? So you will say like this, Madam, magnesium ribonucleate theory. So this is not the way, proper way to answer. First of all, you are not answering. You are asking question to the examiner. Now you are not going to take the exam now. You have to understand, you have to mention it in a polite way, in a way that should not feel overconfidence as well as underconfidence. Answer in an appropriate way with the proper tone. If you don't know answer, say I don't know, or my knowledge is up to this. Whatever you present it with confidence. That suggests the student in depth has the idea of the knowledge as well as concepts are clear, and he is confident that he knows. When you mention like that, examiner will understand you are just bluffing the answer, you don't know the answer. Now the time management for the theory. So in theory, what you have to do is understand different university has different paper style. Some will ask 20 marks 5 question, some will ask around 30 marks question, some 20 marks question, some 10 marks short note, something like that. So understand, if you have 20 marks 5 questions, so you have to understand, you have to give 30 marks 30 minutes for each question. You can divide this time management according to your paper style. Now why? Whenever you got the paper, first of all is give 2 minutes to read the paper and understand. By reading the paper, you will definitely get the idea. I know this many questions, among which this one is the best one which I can be present in my exam. This one question I don't know at all, and this one question I know partially. So the one which you know the best, you will start writing with that. But that doesn't mean you know it best, you will use 45 minutes to write that particular question only. Because the time management is very important. So 2 minutes you will understand which question you will answer, in which chronology. That later, after that, whatever question you will start writing, among which again you have to give 2 minutes from the 30 minutes to bifurcate the questions, how you will answer it. In the rough paper, take and start mentioning under which headings you are going to write this question. In some universities, they by themselves divide the questions under subheadings. So these are the subheadings in which you have to present. But if short note is there, you have to define the headings and later on the subheading. So give 2 marks for this, which diagram you will follow, you will draw, how many flowcharts you are going to present. If something is very bold, you will never get time to underline something. Simultaneously you can write, and if anything you want to highlight, write in the capitals using full, like this are the 2 lines. Start writing from the first point to the end point in the capitals. It will automatically highlighted in your answer sheet. Hope these things are clear to you while attending a question paper. Are you getting this? Show me some reaction. Is it useful? Are you getting what I am saying to say? Then we are focusing. Okay. Yes. Thank you so much. Now regarding the time management. Why I mentioned that never leave a question unattended or unanswered. See, if you feel that you know 3 questions and in that you get 90%, but 2 questions you didn't attend, or in 1 question you get 70, in 1 question you get 80 marks, in another question also you get 70 marks, but you didn't answer 2 questions, your marking systems drop down to 54 when with 90%. But if it goes below 70%, it is difficult to pass also. So never ever any question unanswered. Leave any question unanswered. So what you will do, if you got something which you haven't read, like hepatitis G virus, so what you will write in this? Never bluff in theory as well. Start writing something similar to this. So hepatitis G virus, you know the classification of the hepatitis virus. So start writing with the hepatitis classification, family, its gender characteristic. Then go with the hepatitis G virus. And the laboratory diagnosis, you know na, for all virus, it is by PCR or either antigen detection or antibody detections, like that. So you have to understand they are non-cultivable, something like that. For any bacteria, how you can go, you have to think and write accordingly. If it's hepatitis, definitely it will going to be cause jaundice, hepatomegaly or something like that. The clinical manifestation has to be mentioned. Hope this is clear to you. So that's why never ever leave any question unattended. Now let's just check how to answer regarding the questions. So what do you mean by blueprinting? Blueprinting is something that is a syllabus distribution among the papers. So in your first to 4 paper, certain university follow like that. Paper 1 is general microbiology, immunology, genetics, antimicrobial, infection controls. Paper 2 and 3 is systemic. Some university mention paper 2 is for bacteriology and paper 3 for viro, parasito and myco. But nowadays, as it is CBME, certain university, they make it like a systemic microbiology with paper 2 and paper 3. Paper 4 is recent advances. Now, what is the blueprint, that the distribution of mark with this system? So understand, in general microbiology, it's around 30%, immunology it is 30%, genetics 20, and antimicrobials and infection control is around 20 marks. Now this is a rough distribution, and for bacteriology is 40, virology, parasito, myco 20%. Now in generally syndromic approach, what you will get, here comes your practical preparation. Why I have mentioned do not leave it up to the end, because generally it will be asked like an approach of a case or syndromic management of a meningitis, of diarrheal disease, of sexually transmitted infections, of a pneumonia or lower respiratory tract infection. And these are also frequently asked long cases among your practicals. So you should know, and the approach is very well mentioned in our postgraduate MD Microbiology crash course. Now I'm going to mention you in just a brief what is postgraduate MD Microbiology crash course. It is a crash course which has mainly for DNB and MD Microbiology students, which I have developed an app in which this course is there, which has all the videos regarding the approach of a clinical case, like long case of a meningitis, how you can answer a long case of dysentery, pneumonia, and these, and how to approach is, first of all you have to differentiate among differential diagnosis based on the case history, followed by etiological agent you have to mention, the pathogenesis, clinical manifestations, the laboratory diagnosis, which samples has to be sent, how to send, what could be different Viva questions regarding that, and how to do a prevention and all this thing. Now, so for second and third paper, this is the approach. So for that you have to know all the syndromes. Still in this case, certain questions like cat scratch disease or melioidosis, mycotoxicosis, what is Glander's disease, or mycetoma, like this can also be asked. Now let's go to our paper 4. Now paper 4 is basically of the recent advances. So student always ask me, madam, please mention the recent advances topics. We have uploaded frequently asked topics from paper 1 and paper 4, which is similar things with the paper 1 and paper 4 on the app, the topics which are frequently asked and must know for your theory exam. And these are, you should know all the recent advances in laboratory diagnosis like Marliter, Candida T2 Menon, Candida Menon antigen antibody test, what is T2 image, Candida biomarkers, fungal biomarkers, recent advances like Marlitov, PCR, multiplex PCR, all the PCR, even all the related with AMSP. AMSP is nowadays frequently asked, and in that diagnostic stewardship, antibiogram, how to use antibiogram, role of microbiologist in for NABL accreditation or in NABH accreditation. In this, the role is different in both the way. Students, you often confuse between these three topics, that is accreditation process, quality control in microbiology, and ISO 15189 2022 standard and NABL 112 standard. Understand, these are the three topics, but the answer of all three are different. It's not the same, but students will only mention pre-analytical, analytical and post-analytical quality control. Definitely it is going to be covered in the quality control, but not in all the question. These three topics notes are already uploaded in PG crash course. Now understand how to write the question. We have mentioned recent advances in laboratory diagnosis all infectious disease like tuberculosis, HIV, meningitis, etc. So what happens whenever we check the or malaria, what student will mention? If we mention laboratory recent advances in laboratory diagnosis of tuberculosis, what you are going to write is, you are writing, generally you people write is gene expert, TrueNut and Midget. Understand, these are not recent advances. These are routine investigation for diagnosis of tuberculosis since a long, and nowadays NTEP program is upfront recommending this. So understand the difference between what has been asked and what you are writing. That's why you are not getting marks. So all these type of notes are already available in PG crash course that is postgraduate MD Microbiology crash course at Micromed. Now you have to understand what has been asked and how, which topics, which subheadings you have to understand and write. Hope this much is clear to you. Please show me whether you are able to understand or not. Okay. Do you find it is worth listening or not? Okay. Thank you so much. So here, student, I am going to tell you certain questions that you must prepare in your examination for postgraduate. The recent advances in malaria, tuberculosis, all the topics that is mentioned, you can always take a screenshot of this, like NGS, MALDI-TOF, rapid AST, syndromic panels, AI in microbiology, antimicrobial stewardship, basically diagnostic stewardship, One Health concept, gene therapy, surveillance, NABH, quality control and role in NABH. Now regarding newer antimicrobial, you have to understand it doesn't stop with newer antibiotic. You have to think of newer antibiotics, newer antifungals as well as newer antituberculous, that is bedaquiline and delamine. And definitely these are the questions you will get. Even one more question you will get either in the paper 1 or paper 4, that is a recent outbreaks in world or in the India as well. You have to understand, you have to know Ebola, Hanta, Noro, each one, as well as the national programs implemented in microbiology. This also you should know. The majority of the topics which we have discussed all are covered in postgraduate MD Microbiology crash course. Now the most important, understand in paper 1 on which thing you have to focus. See, generally the paper 1 and paper 4 you will get either of these. Among these, one question would be there. So one question of vaccine. So read all types of vaccine, reverse vaccinology, edible vaccinology, messenger vaccine, each and everything regarding vaccines, genetics, sterilization, disinfection, in that especially ETO, plasma sterilization, Spalding classification, etc. Focus on this. CSST. Role of microbiologist as ICO for NABH. See, for NABH the role is different and for NABL it is also different. You have to understand. AMR, accreditation, biosafety, automation or AI. Either of this would be there in paper 1 or paper 4, definitely would be there. Recent molecular techniques, even isothermal amplification is frequently asked in various universities. Understand, in that you don't have to write PCR, it is isothermal. So in that another like lamp would be there. Hope you will be able to understand this, and we are moving to our practicals. Theory complete? Samajh aaya? Yes, okay. Now let's understand practical approach. So in theory you have to focus on all these topics, start preparing notes and read those notes just before your exam. On the day before, you cannot miss these topics without understanding. And also one important thing that I forgot to mention, start writing these questions. We at our college, in our postgraduate student, we every Saturday they write at least 2 questions, 20 marks within 30 minutes span. We give them 30 minutes and we ask them to write. First they prepare, they come prepared and then they write. So by this you get the habits of writing, you know how to focus on the presentation, and it improves your skill. So once in a week you have to write at least 2 questions, and understand this, around 25 to 30 questions you have to focus and you have to write with a stopwatch. Now practical. The practical is different. Student, what you feel, in your practical exam you got the case, long case, short case, clinical case. So you feel, I got this organism, I have identified this organism and I mention the name, so I am going to pass. No, examiner doesn't only want that you have identified it correctly or not. They generally assess your approach, diagnostic approach, whether you are able to understand it clinically, logical reasonings are there, data interpretations with the clinical cases, and your confidence when you are answering. Everything is assessed in your practical examination. So what are the mistakes generally you do and on which thing you have to focus? First of all, whenever your practical will be started, you have to get yourself calm and compose. Keep your table always clean and organize your work. How to organize your work? You have to keep at one point long case, one side short case, another side like mycology case or something like that. Never mix your plates and biochemicals of individuals with together. Never do like that. Second thing, regarding your appearance, your body language should be appropriate, your attire should be, you should be properly dressed, your apron should be nicely washed as well as pressed. You have to organize your work and always ask controls to your experts as well as your examiner. Now, what generally feels, if you don't ask and later on the examiner will ask you why you didn't ask, it would be a very big, very not good impression towards the examiner. So you have to focus on this. Whatever you are going to present, you have to write down in your supplementary. You can use a full and divide it according to long case. In long case, what you will do? First of all, what you will, the first Viva is of, anyone knows? You can write in a chat as well. The first Viva is always on the case. So in the case, what you will be asked is, you have to pinpoint to the clinical diagnosis and then put the differential diagnosis. So you have to understand that, followed by you will be asked the etiological agent. When you perform a gram stain and motility, you have to write the gram stain interpretation in your supply. And whenever they ask you, don't fumble, read it from your supplementary. And whenever you have to write it all the parameters of the gram stain, like bacteria size, arrangement, capsule, each and everything should be focused and right. So whenever you write and you speak, you don't forget. But if you start, don't directly jump. Madam, there are 2 types of GNB present in my sample. Never say like that. You can say two types of gram negative bacilli are seen, among which one is short and stout, capsulated, and another one we can feel is pleomorphic in nature. Like that, you have to thoroughly, in your exam, you can use the gram stain terminology, how to present each one with the size. The size should be never only mentioned like short, stout. You also have to be like short and stout, like around 2 micrometer into 1 micrometer in size, thin and long 4 micrometer into 0.5 to 1 micrometer in size, something like that you have to mention. In motility, never mention I can see motile gram negative bacilli. In motility, never, you cannot appreciate gram reaction. So mention it's motile rod, motile or non-motile rod, or cocci, something like that. Biochemical and AST interpretation also thoroughly be mentioned in your supplementary, and you have to speak. And based on how you have to answer, that also you have to understand. You have to say, based on my case history, gram stain and motility, I feel the probable organism could be this. You know the case of enteric fever, you have get either salmonella typhi or paratyphi. But don't jump directly that it is a salmonella typhi. You have to mention in this way. If you want to learn this type of approach, it is already available in PG crash course at Micromed ED. Understood? How do you have to answer? Yes. And conclusion, that next, the first day you can go at home, you know your case, how you are going to present tomorrow, that you have to understand and practice once and speak, because when you mention in this way, examiner will understand. They will always ask you, you summarize your long case, you summarize your short case. The AST always understand that which antibiotic you will ask. They will never allow you to check. You are allowed to use CLSI for interpretation, but never when asking antibiotic disc. So in your S typhi case, the examiner would ask you which antibiotics you will take for AST. So you should know the antibiotics for rest of the organ cases as well. But the interpretation, the zone of diameter or MIC is not recommended, that you should remember. So here the approach is identify the clinical syndrome, list the probable etiological agent, select appropriate samples, how to choose that sample, how to send that samples, which are the other investigation is recommended, plan your laboratory diagnosis accordingly, how to interpret various results, and antibiotics recommended in that particular case is, and how to finally summarize your diagnosis. And these are the most commonly asked cases in your examination, like meningitis, cholera, enteric fever, dysentery, UTI, pneumonia and sepsis. All practical approach has been uploaded in PG crash course. Student, समझ आ रहा है? Are you able to get? Yes. So we have covered our theory, we have covered practical long case, short case. In clinical case also sometime you will get this type of cases. Now comes the spotters or the spotting. So spotting, generally you will get smears. So basically either a histopathology smears, gram stain smears. In histopathological you have to understand, and I'll say not understand, and mug it up. Mug it means ratta kar lo. How to mention the HPE interpretation of tuberculosis, aspergillosis and zygomycosis. How you can mention the interpretation. So in like HPE, the tuberculosis looks like there is a granuloma formation with the presence of Langerhans, giants and fibrosis, etc., etc. Ask your pathology book and check it that, and you have to understand. Similarly for aspergillosis, because these are the most commonly used smears in practicals. Ginseng stain with PCP can also be asked, and gram stain of pneumococci, H influenza with pleomorphism or gas gangrene is generally asked, and also a malaria parasites, schizont, ring forms, eccolforms, gametocyte, like this are generally mentioned. Or even sometimes instruments can be asked, or a LPCB mount of particular, that can be DPX mounted, can also be used. Now in your exam you also have a pedagogy, or sometimes examiner asks you to present your thesis in a pedagogy. So understand, either the thesis will be asked in your grand viva or in this way. So thesis, these are the cardinal questions will be asked. You have to mark these questions answer before your exam, and you have to revise it. You have to ask any of your faculty that please ask me question, I am going to answer, and please correct me if I am not answering it appropriately. Like why? What is the rationale behind this study? What are your studies objective? how the study was done. So methodology. Understand, whenever you mention the methodology, it has to be from the reference should be available from a standard textbook or a standard guidelines. It's not your novel method that is recommended. A standard methodology reference should be available. What are the results of your thesis? What is the conclusion? What are the limitations of your study? And what are the further recommendation? These are the frequently asked questions. So you have to understand and remember and revise this, and you can able to answer. So you can easily grab from 10 marks, it would be around 10 marks or 20 marks. So from that you can get at least 8 marks. This is your approach should be there. Clear, students? Shall we discuss a clinical case? Okay. So the clinical case can be a syndrome based case like anyone, or HAI case, ELISA report, LJ chart report, PCR graph, EMSP case, infection control case, like NSIO is there, how you can approach, antibiogram interpretation, all these things can be asked. So student, what is the problem with you when you would be given this case? Like, understand, an ELISA report is being given to you, or LJ chart given to you, or PCR graph. You see and directly you say sample A is positive, sample B is negative, and sample C is also negative. This is not the correct approach. First of all, how a clinical microbiologist answer this particular case? First of all, you have to understand, whenever you get whether the IQC, that is internal quality control, has been done in that particular, what is the result of IQC, whether the run is valid or not, if the LJ chart is given based on the IQC, what is the Westcard rule is applying, whether you can sheet any trend or something like that. You have to understand these things. Never directly jump to that. So if you later on you say yes, the IQC is appropriate, PC, NC for this PCR graph, NTC you have to also check, IC is also there. Now the run is valid, so we can interpret the results of the various samples. And now as per this sample is like this, positive or negative, something that you have to mention. And if the clinical history is there, whether it is correlated with the clinical history, that you have to mention. Now the interpretation of the ELISA, LG charts and PCR graphs, the videos are already uploaded in PG crash course. We have prepared with the various examples how you can approach these cases. Regarding antibiogram, see, antibiogram you have to understand, yes, this can be also frequently asked question in paper 1 or paper 4, the antibiogram types and its utility for empirical therapy. So you have to understand what is, first of all, it is which type of antibiogram is given to you. Based on that, you have to identify various empirical therapy recommended for individual infections and individual organism. If it is like a cumulative one, you can only answer for the organism wise, but not in depth. But you can always mention the differentiate. If we can get an enhanced type, you can answer accordingly. Hope you are able to answer. Now the Viva is, you have to answer it confidently, concisely, and if you don't know answer, you say 1 minute, student, just a minute. Yes. Am I audible? Yes, okay, thank you so much. So if you know the answer, you have to mention that and answer it confidently. If you partially know the answer, you have to mention in your exam that my knowledge for this particular is up to this, okay? But if you don't know the answer, don't stretch it. Don't think like that, wait for 2 minutes, never like that. Understand the number of questions answer you attempt, you will get more marks. So if you don't know, you say, sir, I don't know or I'm not sure, like that. But if you have been asked that, what is gas gangrene? In your grand viva, like this, the question has been, what is gas gangrene or define gas gangrene? You have mentioned the definition of gas gangrene and then you started, the etiological agents of the gas gangrenes are like this, and this, the risk factors. Never do like this. You have been asked only the definition, then stop. The next question would be the etiological agent. After, so you can lead your questions to your examiner. Stop whatever has been asked, so you will get multiple questions, and you know the next question would be asked like this only, and I know the answer. Understood? This is how you can lead your examiner. In your Viva, Grand Viva, the most commonly frequently asked topics are related with AST, CLSI, UCAST, AMR mechanisms like carbapenemase, MRSA, HAI, molecular diagnostics, vaccine, and the biosafety. Understand, student, the approach between theory and practicals are different. In the theory, you have to organize the complex things and present. In practical, you have to use your logical reasoning for diagnostic approach and conclude your case. This is the difference between theory and practical. Regarding the 60-day prescription for the distinction is, always use 2 to 3 topics daily from the theory, 1 practical case analysis, use Viva questions. Now, if you don't know which could be the Viva question, among how many of you have ever been an expert in MDA or DNB exam? See, in major, even though you would be an expert, you will not allow to listen the Viva's questions by the examiner. In Micromed ED, we have crafted more than 30 Viva FAQs, 35 notes for Viva FAQ for your individual Viva. Like your first Viva is related with the gram stain and staining and morphology. So all the frequently asked questions with the answer has been covered in that. So these type of questions you have to read, understand, and remember. When you do revise, it will be helpful you in your theory as well as in practical, because if a staining techniques will be asked in the theory, you will know the classification, what is the importance of the gram stain, the application, etc. Everything is being covered in the Viva FAQ. By this, when you read this, you revise it as well as you are able to answer it appropriately. One recent advanced topic, and at weekly, as I mentioned, 1 grand Viva revision by asking your faculties to take spotter revision, and 1 questions answer you have to write. Students, are you able to understand or not? Okay, thank you. Now regarding the how Micromed ED will help you in your preparation, we have a theory questions, we have practical Viva FAQs that is been mentioned, practical exam step-by-step approach on all long cases as well as clinical cases, HAI as well as ELISA, PCR graphs interpretation, and concept-based video of various topics which are difficult to understand, like tuberculosis. The books, it is excellently given in the Apurva Sir's PG Microbiology textbook, Essential of Microbiology for Postgraduate Students. It's very beautifully mentioned, but it is very difficult to remember. That has been covered in depth in 4 lectures, with everything has been covered. So if you want to join Micromed ED, the link has been, we can share it in the chat. So how it will help you, that the structured learning is provided. approach will be taken, and you can, as it is a app, you can use it in your mobile phone, on your laptop, on your iPad. It is works on Android, Apple, iPad, laptop, everywhere. 150 content is uploaded, 56 videos are there, 22 notes are available, 35 Viva FAQs are there. And students, now we have started uploading. Among the 56 videos, more than 20 videos PDF has been done and uploaded. So after clearing the concept from the video, you can use the same PDF for your revision. So you're no need for read any books when you watch that video and read that PDF. That is my guarantee, because that has been prepared by reading 4 to 5 books and the recent advances. I'm going to provide you the links of in the chat, all the links that is available for because last time there's so many students asked me for okay, I am pasting all the links. You have to understand, last time there was so many questions were there. Student, understand, the link for Android phone is there, link for iPhone is different. You have to use individual link for downloading the app, and later on for Android as well as iPhone. For iPhone, the My Institute app will be there, or Class Plus app. You have to use the organization code that has been mentioned in the chat. This organization code you have to write, and later you can enroll in the course, as well as you can purchase the course as well. There are 2 different courses are there. One is free course that lasts, the validity is for 7 days. You can check the video content, notes, etc. and judge accordingly. Now this question, I am open for all the questions. You can write your question in the chat box. Any more questions? Any questions, students? Okay. No more question? Shall we end today's Google Meet here? Yes. Please provide a feedback in your chat box. Do you find it, because I want a feedback from your side, whether do you feel that today's lecture is beneficial for you? Please write down your whatever you felt, whether it's good, better, need some improvement from my side. Write in a chat box so we can work on ourselves. But I prefer that you please write in the chat box your genuine. Ma'am, for general microbiology, genetics, how to approach note. Notes are available in PG microbiology crash course. And understand this, it's been only 3 months we have launched this course. When I launched before 3 months, the content was only 42 and today it's 150. Daily we upload. You can ask your colleagues or peers who have joined the postgraduate MD microbiology course. Daily we are uploading the content, and majority of and whatever the content I am uploading, basically I am focusing on the most frequently asked questions, whether it is for the video, notes, anything that I am uploading, it's definitely is frequently asked in your exam. That's why I am preparing either video, notes and upload it in the app or in the course. immunology also, how to memorize the flow chart. How can you extend for 2 years plan? Understand, for 2 years plan, after your 6 month, you please go renew your for two years plan. Don't enroll before your validity stops. Ma'am, only 50 times only we can view the practical videos. Yes, I don't want that the student should share the 50 times is more than enough for, because the video is around 30 minutes and we have uploaded around 53 videos and live classes also, so around 50 to 55 videos are there, and PDF has been also given provided to you, so you can easily revise it. Can you please share the slides of 60-day program? Yes, I am going to upload this even in the crash course, this PPT. Thank you so much, ma'am, for wonderful session. Thank you. Thank you so much. Thank you. Oh, please let me know also how do you find this today's presentation. It takes only 1 minute to write. Do you like it? You don't like it? Do I need some more? Can you please write it so I can take a screenshot? It was helpful, yes. Thank you. Thank you, Dr. Priyal, Dr. Vinu, Dr. Sandra, Dr. Pooja. Yes, how to prepare for this question was already asked by me, I think by you only. Understand, for IDs, if you want to go for DM or something, you need to understand the approach. Please go through the approach lectures in the PG crash course. Also, all the practical based approach is very helpful, and also join my live class whenever I am taking. In that also we discuss how you have to do and how do you follow the approach. I'm starting to get some orientation towards the practicals. Good. Student, we are going to be disconnected within 1 minute. Sorry. Any more? It's in the chat box, Micromed ED. The live classes would be there, or whatever is there. Please join the Micromed ED community. Regular update will be available. Please follow me on Insta and join the community and download the app. You will get all the updates regarding free webinars, lectures, live class. Everything would be available in that. We are going to mention the already mentioned in the chat box the app link. Thank you so much, student.